Eclampsia is a serious condition that occurs in pregnant women, characterized by the onset of seizures. It usually develops after a woman experiences preeclampsia, which is marked by high blood pressure and potential damage to organs, often signifying a risk for the mother and the fetus. The transition from preeclampsia to eclampsia can be sudden, making recognition of early symptoms crucial for preventing complications. Awareness of this condition can save lives by enabling prompt medical intervention and care. The primary symptom of eclampsia is the occurrence of seizures. These seizures can manifest as dramatic convulsions or less noticeable twitching. Identifying these seizures can be challenging, particularly in a hospital setting, where a woman's vital signs may be monitored consistently. Alongside seizures, other warning signs of advancing preeclampsia should be attentively watched, such as severe headaches, visual disturbances, or swelling in the face, hands, and feet. These indicators necessitate immediate medical evaluation to prevent progression to eclampsia. Risk factors for developing eclampsia include a history of high blood pressure, obesity, and being over the age of 35. First-time pregnancies are also at a heightened risk. Other factors include a family history of preeclampsia and multiple gestations, such as twins or triplets. Understanding these risk factors empowers expectant mothers and healthcare providers to take proactive measures such as regular checkups and monitoring blood pressure. Managing eclampsia involves immediate medical treatment, often starting in a hospital setting. Magnesium sulfate is commonly administered to control seizures and mitigate risks. Additionally, it is crucial for healthcare providers to monitor the mother's and baby's health continuously. In some cases, delivery may be necessary, and the timing can be critical and highly individualized based on the severity of the mother's condition, gestational age, and fetal well-being. Preventive measures may include regular prenatal care, lifestyle modifications, and potentially low-dose aspirin for those at risk. Educating mothers about the symptoms and risks surrounding eclampsia is vital. By fostering awareness and understanding, fewer women will face life-threatening situations, leading to healthier pregnancies and positive outcomes for both mothers and infants. Eclampsia should not be taken lightly. Recognition, education, and timely intervention can ensure that both mother and child emerge safe from this medical challenge